In his State of the Nation speech on January 10th, President Cyril Ramaphosa reiterated that work was afoot to establish the highly anticipated National Health Insurance Scheme, which is scheduled to take effect in 2026.
We will continue with the work underway to ensure universal health coverage for everyone in South Africa, regardless of their ability to pay for medical services or not.
The National Planning Commission, which is mandated to ensure the implementation of the National Development Plan, says it totally supports the idea of universal health coverage, but it's raised concerns around certain provisions in the National Health Insurance Bill, which is currently the subject of public hearings in National Parliament.
The Minister will appoint the CEO, the board, the 3 advisory committees, the appeals panel, and we believe this is not in line with proper governance principles.
Given past governance scandals in the country, the NPC says it's vital that the NHI fund and its management are legally designed in a way that maximizes transparency and accountability. It says, as things stand, the health minister would wield too much power, and that needs to be reined in.
And in that regard, our proposal is that the public must nominate people that it believes are suitable to serve on the board. And the Parliament sort of does the interviews and recommends to the President to appoint the board. The board would then appoint its chair and deputy, and then the board again now appoints the CEO and executives.
The NHI will be a massive fund with current estimates topping 400 billion rand. The MPC says it doesn't believe it's wise or correct for the NHI Fund's board to be charged with the task of investing those funds, saying that task should be led by National Treasury instead.
We see that there is about 11 board members that will be appointed, and of course, as it's supposed to be, most of them, we believe these would be experts in the field of healthcare management and healthcare policy. So even if you were to get 1 or 2 finance specialists, you're not going to get the broad range of skill in the very specialized area of investments to do this properly.
The COVID-19 pandemic has brought about efficiencies in medicine, like telemedicine and outside clinics. And while the affordability and the costs associated with the National Health Insurance Scheme remain in the realm of speculation, healthcare analysts say it's currently impossible to gauge its affordability, although technology could go a long way in bringing healthcare costs down.
So using technology, but also using techniques such as task shifting and task sharing, because by doing that, many complications can be avoided, but also having that team approach to solving healthcare, I think, will bring a far more cost-effective as well as a far more sustainable way of providing healthcare into the future.
If done properly, not only will the NHI provide all citizens with universal access to quality healthcare, but it could rehabilitate the fortunes of the economy. Besides, a healthier citizenry is good for economic growth. Nampumelelo Siziba, SABC News, Johannesburg.